All right, so welcome everyone to the Hemophilia Council of California's Advocacy and Policy webinar. My name is Elaine Kintz. I'm the Executive Director of the Hemophilia Council of California and wanted to welcome you to the California Children's Services What You Need to Know webinar that we are hosting this evening.
Are 5 managed care plans in California that operate a whole child model. So CenCal Health, if you're in San Luis Obispo or Santa Barbara, Central California Alliance for Health, if you're in Merced, Monterey, or Santa Cruz, Health Plan of San Mateo, CalOptima for Orange County, and then Partnership Health Plan of California has 14 counties in the Northern California area listed there. Also, in terms of accessing services, so hemophilia treatment centers are generally designated special care centers. And if your child has CCS, then they should have access to a hemophilia treatment center. That is where they will get their care. Treatment is provided when prescribed by a CCS approved doctor and authorized by CCS. And the CCS website has a list of providers, so you can find that list on the website. In whole child model counties, so if your child is enrolled in the health plan or managed care plan, I think I've been using those two terms interchangeably. The health plan covers everything except for medications, and that includes Factor and Hemlibra. So in all counties, whether it's whole child model or not, medications are the responsibility of Medi-Cal RX, which you also may know it as Magellan. It's the new pharmacy benefit provider for the state of California for anyone who's enrolled in Medi-Cal. So all medications now go through Medi-Cal RX, and the customer service number for Medi-Cal RX is there on the slide. Have on hand, it's really easy to find that number online too by Googling Medi-Cal RX. So one note about Factor: if your child's Factor is dispensed through your hemophilia treatment center, then it may still be authorized by the county or state, just because of different ways that it's coded and billed. But if you get Factor through a specialty pharmacy, then it will go through Medi-Cal RX or Magellan. So if you're not sure, or if there are any issues with that, just be in contact with your county CCS, and they will help figure that out. If you have any issue with getting your Factor or Hemlibra or any other treatment product, CCS case manager will have access to a portal to check the status of your request and help figure out what is causing the delay. Magellan, the company that's administering Medi-Cal RX, their customer service line is 24/7. So there's that also that you can call, anyone can call. If you do call Magellan, you can follow the prompts on the phone tree when you call that lead to a CCS team. So it helps if you can talk to someone who has like special training and expertise in medications that are common for CCS children. Help online. You can register with the beneficiary portal at the Medi-Cal RX website. So that's another option. So I encourage you to request your monthly shipments as soon as your pharmacy or your HCC will allow you to avoid any delays related to getting the Factor or Hemlibra or medication authorized by the correct entity. All right, next slide. So what about your responsibilities? So you must meet the eligibility requirements. So that includes the application, but also a yearly redetermination. Notify CCS program staff and providers of any health insurance coverage at the time of your application and agree to ask your insurance to pay for services before asking CCS. That usually happens automatically. I don't think you usually have to actually call your insurance company and ask them that. Your provider will usually do that for you. Apply for Medi-Cal if requested by CCS staff. And this one's really important. Update your contact information and any changes like financial or insurance changes that may affect eligibility. Contact us with those right away and pay any required fees.
So folks may, if they're already on CCS, they may have noticed that they haven't had to do a redetermination during the public health emergency. But once the federal public health emergency ends, then all of those redeterminations will resume. And so we're just wanting to remind people that contact information piece that you just mentioned. It's really important to make sure that if you're on Medi-Cal, if you're on CCS or GHPP, you know, any or all of the above, that you make sure that they have your current contact information. And then if you receive a letter from them, that you actually open it and look at it and see what they're asking you to do, because we're not anticipating immediately that the public health emergency is going to end. The federal government said they're going to give us 90 days notice, but when that ends, those annual redeterminations or renewal processes will resume. So.
Absolutely. Yeah, I'm glad you said that. Thank you. Yeah, and especially if your child has Medi-Cal and if you notice that you haven't gotten an email from Medi-Cal in a while, then that's call your local social services or Medi-Cal office and make sure that they have your correct address on file. Yeah, okay, let's see. So this is continuing your responsibilities. So notify CCS when your child is receiving services from a new provider, if it's one that CCS didn't initially authorize. Keep all appointments, follow all treatment plans. If you need any help with your child's, like following through with your child's care plan or treatment plan, then that's what your CCS case manager is there for. So you can call and talk things through with them. Informs CCS of any medical emergency or non-scheduled hospitalization. And remind your provider to notify CCS of changes to the treatment plan or termination of treatment and to send reports to the local CCS office. So these are all things that are really helpful.
I do want to briefly thank all of our sponsors that make this webinar series possible. We have Takeda, Sanofi, BioMarin, Novo Nordisk, Pfizer, the Hemophilia Alliance, and CSL Behring, who help support these presentations. So thank you so much, Meredith, for your time. Again, if you guys have follow-up questions or like specific individual situations that you need assistance with, don't hesitate to reach out to us. And you know, Meredith is specifically there in Humboldt County, but sometimes if I get a particular sticky CCS question, even if it's in a different county, I will call her, and she knows a lot of folks in other counties too, so she can help. She helps us navigate those on occasion. Thank you so much for joining us. We'll see you next month. Bye-bye.